Joining us for our very own first live chat, tagged A Day with Your Fertility Specialist. My name is Sophia Igwan, and I'll be your host for this program. Well, before we go forward, I would like you all to click on the like button and as well follow us on all our social media platforms, Facebook, Instagram, and as well Twitter at Alps Hospitals. Please do not forget to share this as well. Okay, for today our topic would be laser vaginal tightening, or as well known as rejuvenation. And we'll be looking into the what, the why, the how, and as well the process of which this medical procedure gives up a breakthrough. So now today with me is no other person than our very own CMD, CEO of Alps Hospitals and Diagnostics. He is a consultant, gynecologist, and IVF specialist. He is relentless in breaking new frontiers in the world of, how would I put it now, reproductive medicine. And I give to you our very own Dr. Kenneth Eguda. You're welcome, sir. Thank you for joining us today.
I like that. Just that I don't like that title, CMD, CEO.
Why?
Yeah, because I'm a professional, and I like to be referred to as a consultant gynecologist. But that's just by the way. It's nice being with you on this platform.
Thank you, sir, for joining us. So for today, sir, I would like to know, of late, social media has been flooded with so much publicity on laser vaginal rejuvenation, and it has got a lot of people wondering and asking, what is it all about? And I'd like to ask as well, what then is it all about? Like, okay, some people refer to it as laser vaginal tightening, some people call it laser vaginal rejuvenation. So what is it all about?
Oh yeah, so laser vaginal rejuvenation actually just means like renewing the vagina.
Okay.
You know, so it encompasses a whole lot of things, including the laser vagina tightening. So that's to say that laser vagina tightening is part and parcel of laser vagina rejuvenation. White tightening means to bring back the vagina to its original tone.
Okay.
Rejuvenation means to improve in lubrication, improve on pain perception during intercourse, or some other things that have to do with pain around the vagina. It also means improving or curing abnormalities like cystocele, rectocele, and so many other things that goes on in the vagina.
Okay.
So rejuvenation is a broader word, while tightening just means to make it tight for some important reason, maybe sexual pleasure, and all of those things. So laser vaginal rejuvenation is actually a process, it's a gynecological process, you know, where the laser device is introduced into the vaginal canal, you know, and it's used to correct a lot of anatomical or physiological abnormalities that has happened in the vagina over the period of time, either as a result of natural causes, accidental causes, or aging processes. So that's what rejuvenation means, or tightening, just to bring back the vagina to its original state, to serve the function and purposes as intended to for the respective people.
Okay.
That's what it is.
That is actually broad. But then, okay, so for laser vaginal tightening or rejuvenation, let's say, who needs it and why do you think they should need it? Let's put it that way. Sorry, before we go on, I think we have people online, so I would want our viewers to send in their comments and we'll respond to them while we go on with this.
All right, so with respect to who needs it, this is the main issue here. You know, a lot of times you have men visiting the gynecologist, or a female partner visiting the gynecologist, complaining that the husband or the partner says the vagina is too lax, or the vagina is too wide, and the vagina has lost its tone, you know, and sexual pleasure and satisfaction has waned, and some men threaten to look for some other ladies, probably younger ladies with tighter vagina and all of that. But then how do this abnormality happens is the main question. One, you see, the period of childbirth, for instance, vaginal childbirth, vaginal delivery. You can imagine the head of a baby that's about 10 centimeters wide in circumference.
Yes.
Going through the vaginal canal, that's just about maybe 4 to 5 or 6 centimeters width, or in diameter. It stretches the vagina, and tear down some of the supporting structures in the vagina. The collagen is damaged, or the elastin fibers are also affected, the muscle fibers are affected, and and sometimes women get caught, to expand the vaginal canal, so birth is affected easily. And then some women don't only have one vaginal delivery, some have 2, 3, 4, 5, and in Africa, some have up to 7. You can imagine a woman having all of these babies coming through this canal, and then over time the canal gets weakened. Just one delivery actually can even weaken and make the vagina lose its tone, and then it makes sexual pleasure for the man or even for his partner, becomes a problem. So the men feels they don't feel the grip of the vagina, and the women also don't feel the sensation or the orgasm, or don't get orgasm easily, and so it becomes a problem with sexual satisfaction. That's one cause. The second cause is aging. As women age, for instance, you have reduction in estrogen, and when estrogen reduces, the muscle tones in the pelvic floor also weaken or get lost. Then they may have problem with lubrication. Then the mucosa, which is the covering of the vagina itself, becomes thin and easily injured. They get bruised easily during intercourse. And at those stage, intercourse may become painful to the very advanced age woman. Then rate of infections could increase a bit. Then sometimes they could begin to develop some abnormalities, anatomical abnormalities that we call like prolapse, cystocele and rectocele, all because of reduction in estrogen. So whether weakness because of excessive birth or just a single birth or because of aging can make the vaginal wall to be lax and make sexual pleasure to be lost, and make sex because of pain or some other abnormalities undesirable, and so the woman or their partners come begging for vaginal tightening. So those are the category of people who needs it. Or even younger women, for instance, who just feel that the vagina is lax for some reason.
I was going to ask that
question.
Yeah,
Don't have to be old. It could be young women in the 20s, 30s, or the very advanced age. So it actually cuts across all age group. You may have reasons in each of the age groups where women or their partners may consider vaginal tightening procedure to be carried out for them.
Okay, so now most of our viewers would like to know if it requires surgery.
Okay, now when this started initially, it's actually surgical. The tightening procedure originally was surgical. In this case, a woman would have to be operated in the operating room, have anesthesia administered, and incisions are made on the vaginal wall. Then the excess skin in the vagina is cut off and then sutured so it could be tightened. But then you don't rejuvenate the vagina by doing this process. You just tighten it, but there is no rugae. The friction is still not very great. There may not be increased secretions. And the mucosa doesn't still get robust. It still stays thin because estrogen is low. So that was the first procedure that was done before the innovation or introduction of laser vaginal tightening. So the laser vaginal tightening is actually non-surgical.
It's non-surgical.
It's non-surgical. There's no surgery in the process of laser vaginal tightening or laser vaginal rejuvenation. It's just, it's not even done in the operating room. Like this is actually my laser rejuvenation or vaginal tightening room. Look at it, all pink, looking feminine. And this is the couch. It's as simple as it gets. And this is actually the laser vaginal rejuvenation probe. It's stuff you're seeing here, okay? And this is just all that it takes. If this laser machine comes on now, you see the red light, which is a laser light at the tip of this probe. And this probe is just like the size of a penis, maybe an average size penis and all of that, you know, and it's just inserted into the vagina.
Straight into it.
Yeah, of the woman.
Okay.
There's no need for anesthesia.
It's not painful.
It's not painful.
It's painless.
It's just painless. Maybe some little discomfort of warmth because the temperature should be about 45 to 55 degrees centigrade. It gets warm.
Over time, okay.
Yeah, so and it says the warmth or the heat or the light from the laser that does the work. You just insert it into the vagina canal, and with inward and backward movement, the whole surface of the vagina canal is affected by the laser. And then you have now a new production of collagen and elastin and other supporting structures in the vagina. You know, and the collagen and elastin are the things that make the vagina contract again. So it's like you're forming the vagina anew. You know, it also improves the glands in the vagina and makes them to begin to have secretions. So and now this secretion makes the vagina interesting, painless when intercourse. Then it makes the mucosa also thickened, you know. So, and this procedure lasts just for like 10 minutes, 10 to 15 minutes.
That short?
Yes, that short. As against surgery that could last for 2-3 hours.
And the surgery sounds more painful than
exactly.
this.
There's no bleeding,
minimal
discomfort or no discomfort, just a 10-minute procedure. A woman can just walk into the procedure room and within 15 minutes she's out of the procedure and going back home. You know, and nobody even knows what happened. You know, so
is it a one-time procedure?
Oh yeah, now it depends.
Okay.
Now it could be a one-time procedure, but often it's recommended that they have like 3 sessions, one monthly, and every session lasting for like 10 to 15 minutes. No cuts. No anesthesia is required. No, just minimal local spray of anesthesia for those that may not tolerate the heat. Just minimal heat. You know, you could hold the probe like this and you tolerate it actually. So for those who can't tolerate, maybe minimal spray of anesthesia around the vagina would just be enough. And so the woman comes in and goes out. And a session is done within 15 minutes, you know, and the effect is very dramatic, and then everything is fixed.
So are there like side effects to this?
Oh well, there's actually minimal or no side effect. The side effect may just have to do with the heat that she experienced, and maybe some people may have discharge for 1 or 2 days, and then they can return to their sexual life the next 3 to 4 days. After a laser vaginal rejuvenation. But what interests me most is the fact that all the job is done by this probe. Yeah, there are different sizes of probes actually. This is the small probe. There are some vagina that are a little bit wider than these. You know, you have a wider probe depending on
a wider probe
for the size to fit into the vagina. You know, so. So side effect is very minimal.
Very minimal.
Yeah, and no anesthesia. It's not surgery. Just done in this room the way you see it, and and that's all.
But like you said, it's not really painful.
Oh yeah.
And anyone can actually go through it.
Sure.
Old and young. Does it help to increase the lubrication?
Yes, one of the things it does is that it improves on lubrication. So those having dry vagina, for instance, you know, when you have a dry vagina without lubrication, it could cause intense pain during sexual intercourse, and this is common with the advanced age women, those who are getting towards menopause or those who are menopausal. You know, so this actually improves lubrication as well as increase the thickening of the mucosa of the vagina wall. You know, and it makes sex interesting again for this age group of people. You know, then something interesting about aging is that sometimes women get to this stage where they want to laugh, they want to smile, and then they have a leak of urine. So we call that stress urinary incontinence. You know, stress urinary incontinence.
Sorry, I know it's not connected to what we're saying, but what really causes that to lead to
reduction in estrogen and weakness of the pelvic floor?
So it comes with the age.
It comes with aging. So with laser vaginal rejuvenation, that stress urinary incontinence is also corrected. That's what we call it rejuvenation now, because it's not just vaginal tightening. So stress urinary incontinence is corrected by this. Then you have also some mild degree of prolapse. That's when some part of the bladder is falling out through the vaginal wall, or part of the rectum falling out through the vaginal wall posteriorly. With this thing, rejuvenation, because the muscles are toned back to original state or near original state, and the elastin and the collagen materials are reproduced, it closes any defects within the vaginal wall. And so the weakness and the prolapse, cystocele and the rectocele could be taken care of by this, as against surgery, because the mainstay for prolapse treatment is surgery, the pelvic floor surgery. Okay. But early stages or lower degrees of this prolapse could be corrected with this laser vaginal rejuvenation without surgery. So this actually helps a lot. So surgery, being the mainstay, is now taking the backstage, of vaginal procedures.
So basically, technology is taking over.
Oh, sure. And this is not just, this is a very modern laser. It's a diode laser. Before now, we have the carbon dioxide laser to be the popular laser in the world. But now the diode laser is a higher level, it's a higher technology.
Called a what?
Diode.
Okay.
Yeah. So for those who do physics in school, they understand what diode is. Diode. We have the YAT laser, but then this is diode laser. Application is easy, no complications. It's
so
just
basically,
a light.
the diode laser is used for the rejuvenation.
Yeah, diode
or
laser.
Or you could use the YAT laser.
You could use YAT laser for that. You could use carbon dioxide laser to that, but this is the newest technology in the market.
Should
the
be the best,
laser.
I guess.
Well, I guess it's one of the best. Yeah, and it's very easy to apply. Very easy to apply.
So I feel we are getting a lot of reactions from our social media page, and lots of people are asking questions, and they would like to know for now, firstly, let me move to the part where lots of people try to understand. Firstly, for some people that would want to do laser tightening, you know how husbands are and wanting you to probe into their wives and all that. How do you think most people would react to this kind of, what word would I use? This kind of outcome that, they come in, you're probing into their wife, or you tell them, they ask you, how would the process happen? How would it go on and all? And you're telling them, would use a probe, I would go into your wife, and on that 10 minutes, she's out. A lot of people would have a wrong reaction to that. A lot of men would have a wrong reaction to that. So before now, have you had people asking that kind of question as to, can I sit with you, watch what you're doing? Is it okay to do that?
Yeah, understand. We understand that different regions in the world, with their different orientation to medical intervention. I remember taking delivery, or rather watching or assisting in taking delivery in medical school, and the husband was actually angry that little boys took delivery of his wife and were putting hands somewhere that was not necessary. But that's how it goes, So, but then, good enough, in apps, we have both the males who do laser vagina tightening procedures and the female who could do laser vagina tightening procedures. And who does it depends on what your social or religious or cultural orientation is. If you're comfortable with the woman doing it, the woman comes to do it for you, because there's no surgery attached to it. There is no bleeding. There's no need for anesthesia, so you can have absolute privacy as you want to have it. Yeah, but then it involves introducing a probe into the vagina. And as we do in ARPS, men don't introduce a probe into a woman's private part, into the vagina. The ladies introduce a probe.
That's good.
And so, and all it takes is to move the probe in and out, and the same lady could do it. And then all the team members are just around in case there is a technical difficulty, and then it can be corrected. But we've not got one yet. And so it's all dependent on the social, cultural, religious, or personal orientation. So so that's what happens.
So, well, viewers, you can as well drop your questions and they'll be answered appropriately. So, sir, I want to thank you for actually being able to explain this to me before. I actually did not know this existed. You know, like, there are lots of people that will sell pills online and tell you, oh, it will help tighten your vagina, it will help do this. But hearing about this now would actually boost a lot of people's confidence into probably married couples that would want to enjoy their sex life.
Exactly. So there's something we're actually thinking about, you know. Now it's been recommended that even after a single vagina delivery,
yes,
you know, and a woman gets to the 6-week period of preperium, as we call it in obstetrics, she could have a session of laser vaginal rejuvenation. So it's not just for sexual purposes, but it's for health purposes, you know, for health purposes. You know, she could have a session of laser vaginal tightening. So that stretch that happens during labor and delivery, yes, could be reversed shortly after delivery, you know, 6 weeks after delivery, and then she gets back to her normal, pleasurable sexual life. And then even the cut it's administered to some people to increase the birth canal, which is called the episiotomy, you know, could be treated using the laser vagina tightening procedures. And the scars, because it is stitched, the scars could also be made to look healthy. And the aesthetics of the external genitalia of the woman can also be improved, interestingly, with just this little probe you see, you know, as little as it is, it's so mighty. And then we don't have to pretend sexual life is an integral part of human living. Yes. Some are shameful to talk about it, or some are very cultural talking about it, but we're just trying to break the silence, because this is a silent complaint of a good number of men and their female partners, as we have seen constantly in the consulting room. Some go as far as traveling to other countries to have surgery done to tighten the vagina, but I think those are going to reduce drastically, because you don't need surgery to do that. Yeah, with just this probe, a whole lot could be fixed in the female body, I mean in the vagina.
Okay, so Mrs. Catherine Elisha would like to know if it is painful. I know you spoke about it earlier, but...
Yeah. It's actually not painful. You know, it's not painful. The only discomfort you have is the warmth. Heating of the vaginal mucosa or the vaginal wall to about 45 to 50 degrees centigrade. It's a temperature that anyone could tolerate without anesthesia, and that is why anesthesia is not given. But for those who can't tolerate it, or who are anxious and don't want to feel any warmth, you could just give a numbing anesthesia, which is like a spray around the vagina, and then they don't even feel anything. But as we say, the side effect may just be discharge 1 or 2 days after the procedure, and with administration of vitamin C and paracetamol, the discomfort and some other things could be taken care of, you know. So yeah, so it's not painful if you're scared. It's not painful at all.
It's basically painless. Yeah. And Noyama Lillian would like to know if she can attempt a desired result from it. Like, will she yield a desired result when she does it? Like, how do I put it? If she goes in for the process, what results will she get from it at the end of the day? Okay,
now, just as we said, you may come in, you will get the desired result, sure, you know, because it's not just tightening. In as much as it does tightening, you know, if that's the main reason for the laser vaginal tightening, you also have all the benefits. It increases secretion in the vagina. It improves the health of the mucosa of the vagina. You know, it improves on cystocele and rectocele. You know, and it generally improves on the tone around the vagina. It makes sexual life desirable again. So those are some benefits that she could get from it. In as much as being confident in herself, because that's something we may talk about later. Some people are only confident when their sexual life is it's in order.
Yes. Yeah. So is this like, does it give 100% assurance that going through this rejuvenation or this tightening process, it actually comes out 100%?
Okay, now this is a very interesting question, because There's nothing in life that gives 100% assurance,
Okay.
even if you're so sure about it. Yeah, I wouldn't say it gives you 100% assurance, but it gives a great deal of satisfaction. It improves your social well-being, it improves your confidence, it improves your sexual life, it improves your reproductive health and all of that. So to a large extent, you get the desired results from laser vaginal rejuvenation. Whether you're doing it following a childbirth, which I encourage, or you're doing it following complaint that the vaginal wall is too lax, too weak, or too wide, or you're doing it following the symptomatologies of advanced aging in women that comes with menopause or premenopausal states. There's some level of assurance it gives.
Okay, so I feel Noyama and Lillian would like to know as well. Would she have to do it continuously, or is just a one-time thing?
Okay, now for those who are postmenopausal, they may need to do it yearly, even if it is once yearly, to keep improving on the health of the vagina or the reproductive canal. Then for those doing it because of following birth and delivery through the vagina, they don't have to do it yearly. Just do it to correct the abnormalities that is seen. And of course, the frequency will be dependent on what the experts advises. So there is no one size fits all, or one statement goes for all. It's going to be based on the needs of the people. And I think that's what it is. But those who need it recurrently are those who are advanced age, and it's recommended that they have it yearly. It's also very important to know that there are some vaginal infection that happen because of alteration of the vaginal microbial community. Call it microbial flora. Laser vaginal rejuvenation help to restore the normalcy of the vaginal flora, and then it helps in improving your resistance to vaginal infections. And it is recommended that it could be used to treat some resistant cases of vaginal candidiasis. So now it's sounding like it's the ultimate, isn't it?
Yes, actually it sounds that way. Actually it sounds like it's the ultimate. So does it actually help to boost a person's sexual life, other than, like, okay, for example, from some people that have lost it altogether, they do not get the whole sexual vibe, other than the fact that it's lax down there? Does it help boost your hormones and all that, or is just
as for hormones, it doesn't boost
it doesn't
hormones.
affect that
Your
part.
hormones have to be in you in their tanks and volumes. Okay? It has nothing to do with the hormones, because sexual vibes, and to a large extent, has to do with your mind and psychology. But then this is just the act of sex and the health of the vaginal and the reproductive organs. Okay? So for sex and for health of the vaginal region, this is excellent. Yeah. So it doesn't improve the hormones. There's something about hormones.
On that note, we would like to thank you. We would like to actually say a big thank you for actually being here with us, and for the insightful and informative live session on laser vaginal rejuvenation, or, well, tightening, as he said. We also want to thank our viewers as well for joining us, and we hope you join us next time on this insightful live session. And please do not forget to follow us on all our social media platforms at House Hospitals. I will be back again on our next session with A Day with Your Fertility Specialist. Thank you.